Welcome to go first. I'm going to stop sharing my screen so you can present.
Hey, thank you, and good morning, everybody. We have kind of a shortage of EPIs today, so that's why I apologize, because I need to jump in another call. So I would like to share, I'm going to begin sharing my screen. So far, I should be okay. Oh, wait, I need to move I bet that there is a problem because I need to move the camera. Matt?
Actually, it looks good to us. We can see your
Oh, it looks
presentation.
good? Okay, perfect. Then perfect. So monkeypox update for today, that is October 13. Can you believe it? First thing, our numbers. We are in the epidemiology week 41. This week goes, as I always said, from Sunday, October the 9th to Saturday, the 15th. So far, we have had 122 monkeypox cases reported. From those, we have confirmed 36. Again, for the people that has not been here, a confirmed case is the one that we specifically found monkeypox PCR positive. Then we have 24 probable, and that's because not all the labs have the opportunity to do or the ability to do monkeypox PCR. Some of the labs, including the state lab, are doing orthopox PCR. So far, the orthopox family virus, the monkeypox is the only one that is circulating. So it's safe for us to assume that this is a probable case of monkeypox, and all those samples are forwarded to the CDC to finally confirm the cases. But meanwhile, confirmed and probable are counted as a case. And as for yesterday, we had 60. We still have 3 suspected cases. That means that they were reported and we're waiting for the lab results, and 59 cases reported that ended not being monkeypox, what would make us very happy. On the epi curve, and I have showed this before, this one includes the ones that are not a case, so you can see the weeks that we tested more people. For good, this week, for example, we tested, this is our most important week. We tested week 32. We tested 20 people, but 10 were not a case, 5 were probable, and 5 were confirmed. This is really good because following this indicates to us how aware the providers are and trying to detect the disease. This, we need to remember, it was kind of a new thing for us. So at the beginning, we over-test, like you can see here, and they were reported, this is possible, for good were negative, until we find our first case. If we see the epi curve, this is how you actually count the cases. We see the first case was in week 27. And I can tell you exactly, 27 is July 3rd to July 9th. And then our peak was in week 32, and I wrote it here, August 7th to August 13th. And so far, we can see that we kind of passed the peak and we're going down in case reported. We still don't have enough time or report to really know what will be this trend in the future. Many people ask us, oh, what is going to happen? Is it going to stay? If it's going to go? So far, we know that the amount of cases in the community, as you can see here, is going down. And we really hope that will kind of disappear and will be one of those diseases that pops up one or twice, and we will see less activity. But we still don't know what will be the new way to see this disease from CDC, the directions from ADHS. So far, what we can say is that we have less cases and it looks like we passed the peak of the cases. Okay, so week 49 news. Still no school age monkeypox cases in Pima County. And the vaccination efforts in Pima County are ongoing. We will have If you remember, we discussed about, we have 6 weeks in a row that we had vaccination clinics here in Abraham. That helps also a lot on having more people that are at risk vaccinating and download the number of cases. So this Saturday, the 15th, we will have vaccination efforts here from 2 p.m. to 6 p.m. And on Saturday, the 29th, again from 2 p.m. to 6 p.m. The good thing is that now because of the change of how we're giving the vaccine, remember the vaccine was intramuscular and now is intradermal. That means that instead of 1 intramuscular dose, we have 5 of the intradermal. So the amount of vaccines are much higher now because of that change, and that let us expand eligibility for the monkeypox vaccine. If you want to see the exact eligibility, please go to this monkeypox Pima County link, but we're going to say that now. So this is the expanded eligibility. If you remember, we had a 14 days time frame to offer vaccines in case that you were exposed or you thought that you were exposed. So that was the confirmed or suspected exposure. And then if in the last 14 days, you really have high risk behaviors. And now that has been expanded to for any person who has a new STI, sexually transmitted infection diagnosis in the past 12 months. We're talking about a year before. So this is only to give the vaccination to people that could have higher risk of encounter somebody that has monkeypox and get it. So new STI diagnosis in the past 12 months, sexual contact with more than one person in the past 12 months, have been in contact with someone who has monkeypox, like what we know, the confirmed or suspected exposure, have a sexual partner who had a new diagnosis of STI in the past 12 months, and anybody that thinks that they could anticipate that at some point they're going to have these risks. So that's the first portion on the new eligibility. And then we are also open up to any person in certain occupational exposure risk groups. And on this side, the most important portion for us has been people that works with samples or works with patients. So lab workers who routinely work with monkeypox specimens, the people that are going to be manipulating, caring, and everything. Healthcare providers who work in sexual health or STI clinics, and healthcare providers who work in settings primarily serving the LGBTQIA plus communities. These are important because of the risk that they could have at work, and then they can also classify from the other risk in the portion that says anticipate experience risk. So I think that's it. For monkeypox, we are happy that this time we do really good. This is the EPI team contact information. You can call that is our central line. We still need you to leave a message with a clear information on where to call you back. And in that case, please give us the exact extension if it is a central telephone, because sometimes we call back and they are like, I don't know what you're talking about. So we want to avoid that and call you fast. The other thing will be that email, and you don't even need to say what you're calling about. You just need to say school nurse, this name, needs to have questions about whatever, monkeypox, and please call back, and somebody from the team will call you back. And at this time, I think, I add my email and the office and the cell in case you are not lucky, but you should be lucky, and you have the my information if so. So I'm gonna stop presenting. Yay. And let's see if there is any question from monkeypox because I need to jump in another call.
I have just one clarifying question, Mariana. So those eligibility requirements to receive the vaccine, was that they just need to meet one of those requirements, or they need to meet all of those on the list?
Just one.
Okay.
And it's really up to now that we have more vaccines and the production has been ramped up and everything. It's just one.
Thank you.
Okay. If there is any other EPI question, please tell Matthew, and Matt can send an email and we can check it on that side. For this time, I'm really sorry.
All right. Well, thank you, Mariana, for sharing. Always enjoy having you here.
Bye.
All right, so let's talk about COVID. So the good news is our community level here in Pima County continues to be low, no change. Also no change in our transmission level, which remains high. Our case rate is 71 per 100,000 folks. That is slightly down, but still remains higher than the state average. And our test positivity rate is also down a few percentage points. Now it's at 13%. And we're still hovering around 50% of our population ages 5 and up who've received their first booster dose. So, as we enter kind of the season where people tend to get sick, we're looking at, half of our population that could be vulnerable for COVID. It's not to say everybody. Those who may have gotten COVID recently probably still have a little bit of protection, but we continue to highly encourage folks to receive their primary series if they're not vaccinated yet, or if they are and it's been 2 months, to go ahead and get that booster. Here's the map of the country. It's looking pretty nice, especially in our side. Arizona is solid green, which we like to see. This slide just has the information on how that community level is determined. And here we see our transmission map. Parts of our state actually regressed this past week. A few counties went from substantial back up to high. Pima County remains high, and largely in part because of our test positivity rate. Announcements I just want to share with you all. The new boosters from Moderna and Pfizer, those have now been approved for children. So the Moderna is approved for ages 6 and up, and the Pfizer for ages 5 and up. And so those are authorized to be administered at least 2 months following the primary series or their last booster. Also want to share, some of you may have seen the letter that was sent in partnership between our health director and the county superintendent, highly encouraging all schools to carry Narcan on campus. We know many of you already do carry Narcan on your campus. If you're a school that doesn't, or you're unsure, please talk to your administrators so that they can reach out to the county, and we'll be happy to assist in stocking with naloxone to prevent any overdoses at your school. Also available related to that, we have fentanyl presentations that we're happy to present virtually or in person. Those are great for staff. Those also can be adapted for a youth audience, or perhaps to families if we want to arrange something to present to the families at your school. We also have an event coming up later this month, hosted by MAD. This also has to do in responding to the rise of fentanyl. It's a virtual event, and we encourage everyone to share that link and attend if you're able to. Other opportunities, you all kind of get early access because you're the first to hear this, but we are introducing a new program to train youth mental health first aid instructors in our county. So this isn't just to receive youth mental health first aid training. This is to actually become an instructor to then deliver trainings. And so hoping that you can think of those within your network, either within your districts or outside of your districts, that are good facilitators and would be interested in becoming an instructor. We're hosting an information session at the end of this month to come and learn a little bit about what this means, what is the commitment involved, what are the resources needed, and things like that. So please share. Also, we have additional QPR suicide prevention trainings. These are going to be offered through La Frontera in partnership with Pima County Health Department. These are available for school staff. There's a sign-up form, and La Frontera can work with you to find the best time to offer that QPR training to the staff at your school or at your district. Here are our resources. These haven't changed this week. Please reach out to Vaccine Equity if you'd like to schedule a vaccine clinic at your school site. And then we also have additional resources here, including how to request test kits, masks, other PPE if you're interested, and then our monkeypox information. That's all I have for you today. There's our contact information. As always, these slides will be sent out following this call, along with more information on those events that I chatted about. Next week, we hope to have more information on these vaccine updates. So we'll have someone from our vaccine team come on and talk about the new COVID vaccines. That's all I have, and so happy to take any questions if anyone would like to raise their hands or enter them in the chat. I'll give just a few seconds for that. If not, that's okay. If any questions come up between now and next Thursday, feel free to reach out. Otherwise, I wish everyone a wonderful rest of the week. Oh, yeah, I spoke too soon. Something just popped up in the chat. Oh, just a thank you. Thanks, Nikki. Always glad to see you here. Take care, everyone. I'll see you next time.